muscle. In horses, it reaches until the gluteal region. In humans, we do not have this to this extent. And what happens, if you look at here at the platysma, it's very mobile. It overlies the masseter muscle, but I will not cover the masseter muscle because this is going to be covered later by my colleague Sophie. And what happens here, if you look at this one, the platysma continues to cross the angle of the mandible. In most books, when you look how far the platysma reaches cranially, it stops here. But sometimes the platysma muscle reaches really until this level here. It goes very high up. Platysma is located deep to the subcutaneous fat in layer number 3. And you can see here, we even also have a horizontal part. Look at this one. This is also a horizontal part of the platysma. And this horizontal part here is connected via the SMAS to the orbicularis oculi muscle, which is high up in this area. And this is why sometimes when we have contractions of the face, and especially of this horizontal part here, platysma contracts like this, and then we have wrinkles that are like this. Bernard Moll very nicely described this in his paper and called them accordion lines, or also called panfacial wrinkles. This is also one of the reasons because of the action of the platysma here. And now look at the platysma. Here, it's mobile. Here, it's also mobile. Here, still, but here it's not. You can see I can even move the whole cadaver from this area here. And exactly this position here, this here is the location of the mandibular ligament. You remember I showed you in my earlier dissections today the marionette line? The mandibular ligament is exactly located at the inferior boundary of the marionette line. So here we have again, mobile, non-mobile. Exactly, and this causes here the depression that we see from the infraoral area, and this attachment here causes the fact that we have jawling. So just imagine, we have subcutaneous fat lying on top of this platysma. With increasing age, it sags inferiorly, and it sags until this point here, and from here it cannot sag. And this is why we have jawling, which stops here. This is why we always know that here is the mandibular ligament, which forms the anterior margin of the jaw deformity. So if we now reflect all the structures, put them back in place, because this is what we like to do, I would just like to show you here a little bit of depressor anterioris muscle, which is superficial to the depressor labii inferioris, but I will not cover these ones because again this will cover it later. And then let's look into the midline, because in the midline there's one muscle which is sometimes very confusing. What actually does this muscle? What is actually the function of this? And this is mentalis muscle. I just did a very deep dissection. Can we zoom in, please? And if we have this deep dissection in contact with the bone right here, you can see we have the muscle. This is mentalis muscle, and you can see that there are some fibers that insert into the overlying dermis. So now you can imagine when you contract these muscles, you get suddenly cellulite on your chin. I know this doesn't appeal to most of us, but we have this dimpling all over the chin. This is because the muscle fibers here, they just insert into the dermis and they pull it down. And when we try to treat this area here, we can see that we have a fat pad in this area. It's very deep. You can see here you have mentalis muscle, and deep to mentalis muscle you have this fat pad. And this is why when we try to increase the anterior projection, we can go straight to the bone in this area, or we can also do the other way around and insert into this area here, and then have an elongation of the face. So when we now try to think what are the danger zones in this area, you can see there are a lot of arteries which are very small, but sometimes we have a very large artery. This artery, I cannot show it to you because I did not dissect it, but sometimes it's bilateral. One branch is here, one branch is here, sometimes one is more dominant, and this is called the ascending mental artery. It connects with the inferior label, comes from the submental, and sometimes when you inject here, you can have an adverse event which leads to lingual necrosis. You inject filler here, you transmit the bolus via the ascending mental, sublingual, lingual, and then to the tongue. But what about the other major arteries in this area? For this one, we just need to think, where are the danger zones of the lower face? And the danger zones of the lower face are actually located deep. For this one, we'll go back to the dissection that I showed you today in the morning. So we reflect the dermis, we can expose again subcutaneous fat, we also lift up the platysma and deep to the platysma. Now we have the troubles. Now we have really the big problems, because here, look at this one. This is the facial artery, a very big vessel. On top of the facial artery, we have here the marginal mandibular branch, right here. And also we don't have not only one marginal mandibular, we have multiple branches. The other one is here. If I pull this one, you can see how it extends through the parotid-mesenteric fascia. And then also the facial artery gives off in this area another branch, the inferior labial. It gives also multiple other buccal branches connecting to the surrounding area. So it's really